Well, we're here with Dr. Patel today, and Dr. Patel, how are you?
I'm fine, Helmut. I'm fine. Great.
Wonderful.
I'm a bit cooler than where you are. Philadelphia is a bit chilly today.
Wonderful, wonderful. I'm looking forward for snow myself. Well, Dr. Patel, let me ask you a question here. You're a dentist, obviously, and people, lots of people, they have maybe not a lots of, but they have 1 or 2 or 3 missing teeth in their back, and frankly, they're missing for quite a while already, sometimes a few years, and nothing really all that bad is happening, and yet every dentist keeps telling us that it's simply not good to have missing teeth and we need to replace them, when yet nothing really all that bad is happening after having them missing for a few years. Can you shed some light on that? Can you tell us what's going on here?
Well, missing teeth has to be replaced. Every tooth structure which is missing or even broken should be replaced in the mouth. Number one, it keeps the teeth in alignment so nothing shifts in the mouth. Once it starts shifting, the upper teeth starts growing down if a lower tooth is missing. And if the upper teeth is missing, the lower will start growing out. And once that starts happening, the mastication, the biting forces itself will not be giving the right forces to the opposite teeth. So that is one reason why we replace. In the front area, we replace it also for aesthetic reason. The missing tooth is not the best looking face to look at. And even when a back tooth is missing, the teeth start shifting laterally. And when they start shifting, there are gaps created in the front teeth also. So these are the major reasons. Of course, there is digestion problem. If you are not able to chew food nicely, you are just gulping down the food itself. The meat itself is not masticated properly for the digestive juices to act on properly, and then you are not able to take the right nutrients to your body also. So missing teeth is very, very important.
I got it. So what I hear from you, what you said is you said that teeth start shifting and there's too much pressure in one area versus the other one, coming from a mechanical engineering background. So what that means is like you have a door and you only use one hinge instead of the other one, and things get all, you use one too much. I can, from an engineering viewpoint, understand that. So let me ask you, does that have something to do when some people have neck pain, tensions in the shoulder, maybe even headache? Is it possible that because of this uneven usage that is happening?
Yes, the missing teeth will create what we call at the back, what we'll call the posterior bite collapse. And when the bite collapse happens, see, everything depends on the joint. The joint at the jaw is our main area. And once that is affected, when the bite is not properly masticating with each other, then you will have radiant pain going all the way to your trapezius and at the back. And this in the long run can create your movement itself. When you move, many people with missing teeth, when they are affected, they will move slightly tilted. You will see their eyebrows at a different level. When we see it at a different level, then we know the whole gait is affected. And these are the people who need most help. And this is a very, very difficult treatment to solve if it is kept for a long time, because once a joint is affected and once a joint is really disturbed, then the whole area has to be really treated. Not only missing teeth, then you have to treat the muscles, then you have to give the night guard, you have to give so many things. At times you may have to do some surgical intervention.
Well, and I can understand that now, because and on top of it, until people do this, the night guard and the surgical intervention, most likely, so there are probably people running around having headaches, having neck tensions, and don't even know it comes from their teeth.
Oh yeah, tensions are there. When you wake up in the morning, you will see that you are clenching your teeth more. The bruxism habit, once it sets in, you will be having clenching habit throughout the day in stressful conditions. All 90% of it because of the missing teeth.
Unbelievable. So I hope that gives our viewers a good idea that it looks harmless at the beginning, and I guess some of the viewers should realize that if they have tensions, headaches, and if they have tried to fix it but yet it didn't quite go away, maybe it's time to visit a dentist, and maybe there is something to do where the hinges in the mouth are not quite working anymore, and then you guys maybe can fix it. And
it's generally it's not only when there is missing teeth. You should be visiting a dentist every 6 months. But then if there is a missing tooth or any pathology or any part of your body which is not functioning well, you should be visiting the dentist to see that dental problem is all set. The dental masticatory function is up to the maximum, up to the norm which it is supposed to be. Otherwise, it will be affecting somewhere in the whole system.
Well, wonderful. I appreciate you letting us know about that, and I'm sure we're going to have lots more interviews where you tell us about more things. Thanks, Dr. Patel.
All right.